All righty.
Yep, I am now the host. All right.
All right, awesome.
So
Yeah, and let me go ahead and introduce you, John, if you don't mind, before you go into your presentation. So again, thank you all so much for joining us today for our presentation on Medicare Basics. We did a webinar a couple of months ago on Social Security, and I asked clients to let us know if they were interested in any other webinars, and Medicare came up a number of times as a topic of interest to clients, and for good reason. So I reached out to John, who I've known for a couple of years, few years now. He's just got so much information, extremely knowledgeable, and takes a very complex topic like Medicare and makes it a bit easier to understand. I'm not going to say you make it easy to understand, because I don't think that's quite possible, but you do a great job at making it easier to understand. I've had the pleasure of seeing John speak at live events when we used to be able to do that back in the day, and I've always just been very impressed with him. So he founded a firm called Medicare Portal, which is a local Medicare insurance agency, and they provide education around Medicare. They also provide enrollment assistance around Medicare, and he has been in the insurance agency or industry, I should say, for over 30 years. So I'm grateful, John, to you for taking the time to be with us here today and share information. And I'm looking forward to your presentation, as well as hearing what some of our clients have in terms of questions. So I will hand it over to you and mute myself.
Thanks. And well, good afternoon, everyone. It's 12:04. It's officially afternoon. So what we'll do today is I'm going to run through some Medicare basics. I think this will answer some of the most basic questions you have. It may answer some of the more complex questions. The Q&A is always the most valuable part of this presentation. So as Ann said, I'll stop about halfway through, and then at the end, we'll open up our microphones to answer your questions. If it's something that's more complicated, I'll just indicate that and we can address it, after the presentation. I will go through this quickly. We can make these slides available to you. We also have other supporting documents, things that can help you understand Medicare. So if you're interested in getting those, we'll give you a list of options to have, as well as where to find some things at the end. But anyway, I'll get started here and we'll start your education. So I think I have a good sense of humor, but being with Medicare for years like I have been, this kind of summarizes what Medicare is. If you're not confused, you're not paying attention. Tom Peters, for those that know, is a leading management consultant. Our goals today are to share with you understanding of eligibility of Medicare, enrollment process, what we call the real basics, the ABCD of Medicare, what a Medicare supplement is or Medigap, what Medicare costs, and then how to get help. So quickly, who is eligible? So you have to be a U.S. citizen or legal resident. Anyone typically over the age of 65 will be eligible for Medicare. Under 65 with qualifying disabilities. And then at any age, end-stage renal disease or Lou Gehrig's disease will make you, in a sense, almost automatically eligible. So that's the eligibility criteria. What is Medicare? I mean, most of us know what it is, but simply it's health insurance for that same population I just mentioned. To kind of hit it from a high level, Medicare has 4 parts, A, B, C, and D. Original Medicare started in 1966. That's A and B. So during this presentation, when you hear me say original Medicare, understand that's just A and B. Part C, which is Medicare Advantage, was added in 1997. That's all in one plans, basically private insurance companies that administer Medicare and administer and deliver Medicare benefits. And then Part D, some of us may be aware of because it's the most recent one, addressed the problems of Part D prescription drug benefits for those taking what we call self-administered medications. And we'll go over all this in more detail. So I like to do this early in the presentation to kind of shape your thought process on Medicare, to show you that really ultimately it comes down to 2 decisions. There's really a fork in the road, and like Yogi Berra says, you take one. But for this Medicare presentation, I'm going to show you that there are 2 clear options that you have to evaluate when you're making your decisions on enrollment. So option one is original Medicare. So this would be that you enroll in A and B and that you seek out your care through providers that accept Medicare. So if I'm looking for a provider for any kind of service, all I have to ask them is if they accept Medicare, which means that they have a contract with the Medicare system and they have agreed to accept the Medicare payments for services rendered to Medicare eligible beneficiaries. So under this scenario, whether you live here in Virginia, Maryland, DC, or some other part of the country, or you're traveling, as long as that provider takes Medicare, you can see them and no referrals are needed. It's an open access program. So anytime you seek care, Medicare would be billed first. And then as you see in my first slide here, Medicare supplement would be a secondary product that you would buy. I'll talk about it in a second, but your benefits would go to Medicare first and a supplement second. And then if there was any patient responsibility like a deductible, you would pay that initially, and then the supplement and Medicare would cover your expenses. And then to cover your prescription drug needs, you would enroll in what we call a standalone Part D. So if you go this route, which is about 2/3 of the 60+ million Americans on Medicare, you would have 3 cards: red, white, and blue card for Medicare, your Medigap or Medicare supplement card, and your Part D card. So that's one option. Your second option, which I alluded to earlier, Part C or Medicare Advantage, is everything I just described, but administered by one company. It's very important that I point out here that your medical benefits under Medicare Advantage are the exact same as Medicare. They have to meet or exceed Medicare benefits, but they can't offer you less. So what I mean by that is simple benefit. If you went into a rehab or skilled nursing facility, they have to offer at least 20 days of coverage at no cost because that's what Medicare covers. They couldn't offer you 19, 18, 17, or 16 days. They have to offer you 20. They could offer you 21, 22, 23, 24, but they can't offer you less than that 20, for example. So no, I don't want people to be confused that Medicare Advantage is better or worse. Medically speaking, it has to be at minimum equal. This solved, to make it simple, you would have one card for all your care. So prescription, medical would all be covered under one card. Most of these plans are a network-based plan. So it is an HMO at core. So if you lived here in Virginia, you would sign up with a plan that would have a regional network. Some have national networks that you can access. Some may require referrals. Some may not require referrals. This would be more similar to your health insurance, where you make a copay for a doctor visit, you make a copay for a lab or an X-ray or an MRI. Medicare Advantage will have a maximum out of pocket, similar to health insurance. So just trying to shape your mind into 2 products, the Medicare supplement or the Medicare original and the Medicare Advantage. So this is a graphic that goes into a little more detail of what I was just saying. So when you enroll in original Medicare, some of the benefits for Part A are hospital, skilled nursing, as I alluded to, hospice care and home care. That's all that's covered under Part A. It's a very limited benefit program. And then for most of us, we don't pay anything for Part A because either you or your spouse has worked and paid taxes. So Part A is something that you will not pay for. However, Part B you would pay for. There's a premium. It is technically optional. You don't have to do it. But Part B is really what medical care is all about in Medicare. It's your doctors, your labs, your X-rays, durable medical equipment, MRIs, CAT scans, physical therapy, occupational therapy, on and on. That's the real meat of Part B. And then Part D is going to be any of your prescription drugs, both branded, generic, mail order, or retail. Very similar to the way that you use a prescription drug plan, whether today you use it through a pharmacist or through mail order. It's going to mirror that. There are some differences in the fundamental designs that for time I won't go into, but Part D, this is your kind of design again of what you would do under original Medicare. A Medigap, to just go a little bit deeper dive into a Medigap. So in order to enroll in a Medigap, because it's a secondary payer, you have to have A and B. You cannot have A only or B only and buy a Medigap. Medigap is technically not part of Medicare because it's a secondary payer. So A, B, C, D again is actually Medicare part, or Medicare supplement is not part of the system. These are products that are underwritten by private insurance companies. The important thing here to see is the third bullet point, standardized benefits. So Medicare supplements have letters A, B, C, D, F, G, any letter that you pick. So for today, most commonly enrolled is Plan G. No matter what company you buy, the Plan G benefits are exactly the same. They're standardized across the board. So no matter what company you buy, they will pay claims exactly the same. So when evaluating Medigap, one of the big determinants is the quality of the company underwriting it, the rate that they're charging, because the rates will vary just like any other forms of insurance. And then you want to look at their rate histories, because if a company's had high rate histories, once you get in a plan, we don't want those rates to continue to going up. The premiums, as I just indicated, can go up and typically do go up. The premiums are based on your age, your gender, if you smoke or not, and where you live. So, for example, Maryland rates would be different than Virginia, and both would be, say, different than Washington, D.C. So Medigap, again, secondary payer, you have to have A and B underwritten by private insurance companies. This is going to give you Part C here in red. So Medicare Advantage is everything to the left of this as you look at your screen. So again, Part A, you're required to enroll in Medicare Advantage. Part B, you're required to have also to enroll in Medicare Advantage. Sometimes people think, well, if I'm not part of the Medicare, original Medicare benefits, why am I paying it? In a nutshell, the federal government actually sends money to the private insurance companies to manage your benefits. That's why you have to continue to pay for Part B. As indicated here, everything A, B, D equals C. That's a strange algebra equation, but that is what it is. You'll see on TV oftentimes the promises of all these amazing benefits. Where I said earlier, where they can meet Medicare benefits, they can exceed them. So they offer under Medicare Advantage typical things like dental, where on original Medicare, you're not going to have coverage for your basic routine dental care. Vision, they're going to cover on Medicare, say cataracts, but they're not going to cover eyeglasses or contact lenses or even your annual eye exam. Under this situation, they will cover those things typically. Hearing aids are not covered under Medicare, nor is your annual hearing exam. Many of these Medicare Advantage plans will cover those. Oftentimes they offer a gym membership, some offer transportation. So Medicare Advantage, because it's run by private insurance companies and they have adopted this concept of managed health care, preventative care, they want to keep you healthy and have a holistic view or approach to your health care benefits under Medicare. So the big difference, again, original Medicare, 3 different cards, accomplishes the same thing. Medicare Advantage, 1 card administered by private insurance companies. So now that we understand Medicare A, B, C, and D, Medicare supplement, it's important to know when we have to enroll. So for most of us, it's what's called your initial enrollment period, or IEP. This is the 7 months that surround your 65th birthday. So I'm a September baby. So when I turn 65, or when I'm about to turn 65, in June, July, and August of that year, I can enroll or apply for Medicare benefits to start on the first of my month of my birthday. That's very important because assuming I've had health insurance, on August 31st, I'd have health insurance, and the next day I would go on full Medicare benefits, because that 90-day window, once I get my A and B benefits, I can enroll in the Medigap, the Medicare Advantage, the prescription benefits, and have no break. If for some reason you miss that window that I just described, and I applied during the month of September, I actually have to wait till October 1st. Well, why is that a problem? Well, my health insurance ended on August 31st. My Part B doesn't kick in until October 1st, which means I can't get a supplement, a Medicare Advantage plan. I've gone, in a sense, 30 days without really health insurance. And where it really gets scary, if I missed the 3 months that I just described, plus the 4th month of my birth month, now I start getting into October, where if I enroll in October, I wouldn't start till December 1st. And then if I enrolled in November, January, and actually if I waited all the way till December, I wouldn't start till February. Why is that scary? The same thing I just mentioned. I would have no ability to enroll in a supplement or a Medicare Advantage plan because I don't have a Part B active. I'll talk about in a second working past 65, where you can potentially delay that enrollment. But if you're a self-employed person or you work for a small business, as you'll see in a minute, it's very important you understand that you probably have to enroll in Medicare at 65. Now, what happens here is how to enroll if you're receiving Social Security. So many of you, as Ann indicated, may have sat on the incredible presentation of Emily Dupree. This SSI will automatically issue your A and B card 3 months prior to turning 65. For the rest of us, if you're not on Social Security, you actually have to do the initiation, enrollment, the whole process yourself. They do not send you a card, a reminder, email, nothing. So you have to take an active role in applying for A and B, and that can be done. And I'll show you in a couple of ways. We do have, by the way, on our website, we call it our IEP calculator that not only will tell you when your IEP is, but if you register, we will send you a reminder when you are eligible to start that process. How do I apply? So people always want to know how I apply. So assuming you're not on Social Security, you can go to ssa.gov. This is the most common way we tell our seniors to enroll. You actually set up an account with SSA. That doesn't mean you're applying for SSA benefits. You can just set up an account, and may recommend some of you just open an account today because you can actually know what you would get if you retired and stopped working, or if you continue to work, what it could be, all these calculators. So the point is ssa.gov would be your first and easiest way to sit in your convenience, your home, and apply for Medicare. You can, obviously in a pre-COVID world and hopefully a post-COVID world, drive to your local SSA office and do this process. You can do it through the mail. I can send anybody those forms that they need to do that. And you can call the 1-800, the national number, to apply, as well as there are local offices now that with COVID are being pushed down to do enrollments. But there are easy ways to do this. And again, we help in this process. If you need our help, not a problem. The reason that your IEP is so important, if for some reason you miss it and you were supposed to enroll, there's actually 2 lifetime penalties that would be enforced. The Part B penalty would be if at any point from the initial enrollment period, so for me, September, if 12 months from there, so September of the next year, and anytime after that, I would get a 10% penalty of the Part B premium for the rest of my life. And if I went 2 years, it would be 20, and 3 years, it would be 30 and 40 and 50. So today, for simple math, as you'll see in a second, $148.50 is the base premium. If I were to miss a year of that, I would add an extra $100 or $14.80 to my Part B payment for the rest of my life. So not something that you want to do. So understanding your IEP and when you can enroll, obviously this is another reason to make sure that you do it right. Part D, it's the same concept. If you miss your enrollment period or for some reason go 63 days without qualifying prescription drug coverage, you would pay a penalty of 1% per month for every month you go without. The catch here is that they would restrict also just, and I didn't allude to it in Part B, if you miss your IEP, there's only certain times of the year that you can actually add those coverages. So that may also put you in a higher penalty situation because you can't just snap your fingers and enroll when you're ready. So understanding that doing it right the first time is extremely important. This is, I'm going to show people because Medicare doesn't cost the same for everyone. So this first line, as I just alluded to, this baseline. So I'm single, I file my taxes. That's your modified adjusted gross income, something that you could discuss more with your accountant. We're not accountants. But if I make up to 88,000, I would pay 148.50. And if I make over 111, 207, et cetera, et cetera. And if you're married, they just double these numbers, but this is what you and your spouse would pay. And there is an appeal process. So if it's a 2-year look back, so in 2021, if you're on Medicare, they're going to use your 2019 tax return to determine what you pay on this grid. You can appeal that for work stoppage or retirement and then work reduction. So 2 years ago, I made 100,000, and this is calculating that I'm going to pay 207. I can appeal if this year my income is only 50,000 because of a pension or something. So understand this can be appealed. This grid is the same grid for actually Part D. For time's sake, I don't go into it, but Part D also has this IRMA adjustment where you would pay more for your Part D benefits. Understand your income has no bearing on Medicare Advantage, Medicare Supplement, and Medicare Part D actual enrollments into those plans. This is a federal government adjustment based on your income. For those that are curious, about 5% of the population is impacted by IRMA. That funds 25% of Part B costs and Part D 35%, because as most of us are aware, Medicare and even Social Security have some financial challenges. So they're trying to stabilize those income or those the strength of those programs, so to say. Go here real quick. As I mentioned, working past 65, many of us decide to work past 65, and that's a great thing, I think. For those that are either retired or are working for a small employer, you absolutely have to be aware of your Medicare eligibility. So you'll see here, the very first number here, it's all about your employer size. If you're self-employed, you work for a small firm, if that firm has under 20 employees, Medicare becomes your primary payer of claims at 65. If your employer has over 20 employees, your coverage is what's called creditable, meaning that the government Medicare has determined that your benefits meet or exceed Medicare standards, and you can delay your enrollment into A and B. Now, I want to go back for a second, the importance of those that are either like small companies, self-employed consultants, whatever your situation is. Maybe you're retired and you're carrying health insurance through the exchange. Your fear here is not the federal government. Your fear here is your health insurance company. And what I mean by that is if you have a small group employer and you have a claim after 65, and that claim goes to that health insurance company, and they realize you have under 20 employees, they're going to kick that claim back and say, oh, please submit to Medicare first because we're going to pay second. And you're going to say, well, I don't have Medicare because I have your health insurance. And they're going to go, but you need Medicare. That's the scary part of that process. It's not Medicare not paying. It's that your health insurance company can, in a sense, enforce that you're not on the right plan because Medicare is the primary payer of that claim. When you're over 20 employees, your health insurance is your primary payer. And if you decided to enroll in Part A, for example, which costs nothing, Part A would become a secondary payer. So if you went into hospital, you work for a large corporation, and you went into hospital, that claim would go to your health insurance company first, and they would adjudicate that claim by sending it to Medicare to pay Part A. And then if anything was left, you would be the third payer on that claim. So again, to make it very clear, under 20, you have to know your IEP and enroll in Medicare when first eligible. Over 20, we can delay our enrollment on Part B, more than likely enroll in Part A, and I'll explain how that works in a second. Failure to maintain the credible coverage. So if you retire after 65 for that large employer, you get laid off, you reduce your hours, something that makes you no longer eligible for those benefits, you create what's called a special enrollment period, the third bullet point there, that is just like your IEP. It's just pushed into the future because you've carried that creditable coverage. And we'll talk about that in a second. There's two important things to understand about working past 65 in Medicare. And that is that number one, if you're going to fund an HSA, so Ann probably works on your financial planning. If you're someone that has a health savings account, you cannot enroll in any parts of Medicare and continue to fund the HSA. You can use money from your HSA, but you can't fund it if you go on any part of Medicare. Another thing to be very much aware of, if you have an employer that was laying you off hypothetically, and they offered to pay 6 months of your COBRA expenses, while that's great, COBRA cannot be considered your primary payer of claims. So despite you still, in a sense, being part of a large employer, you're no longer an employee. That's the whole key here. So by not being an employee anymore, you lose that creditable coverage title. And because of that, COBRA can only pay the 20%. So much like I said, where it's a small group where COBRA or where your health insurance would be a secondary payer, this is the same scenario. As soon as you get that COBRA notification, if you haven't had Part A or Part B, you need to get it immediately. There's no delaying it because you could run into that same situation of claims going in, being rejected as primary payer, and they would only pay the secondary payer of that claim. During a special enrollment period, for some that ask, because with COVID, there's been some changes, you can't necessarily just call or go into the office. There's actually forms that are required. For those that are in this situation, the form is called the CMS L564. Your employer actually fills that out to certify that you've had that creditable coverage. If you turn in an application without that creditable coverage, you'll either be rejected if you don't apply during the right time of year, or you'll be imposed a penalty because they don't know that you had previous coverage. Be very cognizant of doing that process. And again, we can help you through that whole process. There is a website through SSA that is secure that you can actually do this transaction. You would need to upload that 564, but you can do it online. You can actually mail the Part B application and the 564 into your local office. And again, in a post-COVID world, you can do this in person. Again, you would need that 564, or they will send you home with the 564 and make you come back. So it's very important to know how to do that process. I'll summarize some of the things here because we want to move through this in less than 30 minutes. Know your IEP, as I've said, don't be late. If you're receiving Social Security, you don't have to do anything. However, for the rest of us, if we're not receiving it, you need to take action, as I said. It's important that on a baseline, I explained the difference between original Medicare and Medicare Advantage. There is a lot more that goes into that decision, like making sure your doctors participate in the networks, make sure that your prescription drugs are in what's called the formularies. But make sure at a baseline, like I went over today, if you fundamentally understand those two options, you may already have in your mind the direction that you want to go. Again, I just alluded to this, check with your providers. So if you are going to be enrolling in Medicare here in the near future, start talking to your providers about, do they accept original Medicare? Do they participate with Medicare Advantage? It's important to know that you can access care from the providers that you want. Your employer size, as I indicated, is very important. If you hover around that 20, you definitely want to get that information. Ask questions. We always recommend, whether it's asking questions of us, your employer, ask questions to learn. I'll tell you, be very careful asking advice from your friends because they probably all have a scenario that's a little different than yours and they may have done things differently. So be very, very cognizant of what the information is. Medicare here real quick can be confusing. We understand that. Medicare portal's here to help you alleviate what we call you'll know more and stress less by working with us. We don't want you to have a stressful experience going into Medicare, so we're glad to help. We always recommend starting early, 90 days out from that life event, whether turning 65 or retiring. It's important to start doing your research, again, contacting doctors and things like that. Medicare is an individual decision. I mentioned this earlier. If you're married, you and your spouse are considered two completely different people for Medicare purposes. You're no longer married for, say, your health insurance. So it's important that you both do these steps and understand that you can choose different benefits, and oftentimes people do. Again, select the policies that work best for you. We always like to encourage people that our health is paramount. So medically speaking, that should be your number one decision. And then financial should be your number two. Not that they're not important, but accessing care is the most important thing if we are facing some kind of, whether it's a basic medical care or some kind of advanced situation. We want to make sure that we can access the providers that we want. And then again, at a cost that we can afford. Know the costs. So if you are doing this yourself, there's more than just premiums. Like I said, there's max out of pockets, there's co-pays and other things that you want to weigh before making your decision on the financial end. And again, we can help you understand those. Lastly, there's some resources that you use. I've mentioned SSA.gov, Medicare.gov. MyMedicare.gov you can enroll in once you get Medicare. It's a very helpful site. It's basically the brains of Medicare. It's absolutely something we encourage all our clients to do, to set up an account there. There's actually an app on your smartphone you can download today. It's called What's Covered, that will help you understand the benefits of Medicare. And again, this is if you're on Medicare. If you're on Medicare Advantage, it won't help you. Our website is an educational website. We feel like we simplify and help you speak the basics of Medicare. As far as resources go, our office here is in Tyson's Corner. We have a team of agents here locally that can meet with you virtually, obviously today, but also in person in the future. Local SSA offices, obviously, as I said, they play a big role in enrollment. If you are seeking to do this in person, obviously the phone number can be considered local, but these I just were thinking about local, drivable or accessible points. This is my contact information. So if you need to contact me, or anyone else at our organization, you can reach us at these phone numbers. And at this point, I'm 2 minutes over my promise, Ann, I'm sorry, but I will take any questions that anyone has. And again, you can email me or call me afterwards to, speak if you don't want to speak. There are questions now. I apologize for not stopping, but because of time, I felt like going through it. I didn't want to hold people past 12:30. So I'm sorry about that.
No, that's fine, John. This was great. You went over a lot of information in a pretty short period of time. So thank you. So does anyone have any questions? If you do, just unmute yourself and feel free to ask the question.
This is Karen.
Hi, Karen.
Hi. I have a quick question. I'm only 58, and I work with 20 more employees at UC system, and I keep getting all these changes. Like suddenly now, UCLA has really good health care as long as I fly to California right now, not being in Medicare. But now they're saying that if I live out of state, they're going to give us $3,000 to apply to, I don't know what, because I have no idea about Medicare. And I'm thinking, should I change my address back to California, pay state taxes there because it's better and safer? Because like if you go to anything at UCLA, it's $20. Right now I'm paying 30% of whatever the bill is.
Sure. Yeah.
And
so
I get on a plane every time.
Yeah. So, we work in Medicare, which as you saw, the eligibility is 65. So technically for you, enrollment, unless you had a qualifying disability or end-stage renal disease or ALS, are not eligible to enroll in Medicare today. So, at 65, what you would be, and let's just assume let's just say tomorrow you're turning 65 or here.
I just keep following it because it's always changing.
Yeah. But at 65 in your situation, no matter that you work for a large employer or not, you can always voluntarily go on Medicare because you work for a large employer. That in your situation, if they kept giving you just $3,000, Medicare economically as well as medically may make real good sense for you, because it's none of my business what you make as far as an income goes, but $3,000 is $250 a month. That could go a fairly long distance in offsetting some of your premiums and costs at baseline for Medicare. You with me?
Oh, okay. Yeah. Because like right now, my premiums are $315. And I was looking at all these costs and I'm going, it's cheaper to keep my regular plan than to do Medicare.
Yeah. Well, again, when you turn 65 is when, if you want to, if you're still working in your same employer situation and everything, at that point, even if you called me 6 months out, that would be when we could start having that conversation, because the numbers for every year are released in November. So in November, we'll know the next year. So my point is, whenever your calendar is going to be, coordinating with your birthday, your 65th birthday rather, and retirement or whatever, that's when we really can interject ourselves and provide you in a sense, the financial parts of Medicare, but also to see if medically it makes sense for you.
Great. Thanks.
Oh, thanks for your time, Karen.
Hey, John, it's Sam. Phoebe was asking, is rehab covered under Part A or Part B?
Yep. So outpatient, like in a facility, is going to be under Part A as an apple. And then all your home care, so PT, OT, ST at your home will be covered typically under A, and then sometimes Part B as well. It's just a billing thing. I'm not a provider, but it is covered. Home care is covered at 100%, where skilled nursing gives you 20 days inpatient. And then the next 80, you would have to make a copay of $184 this year. If you buy a Medigap plan, Part G, Plan G rather, that would cover all those 80 days at no cost as well. So these are some of the things you look at that we help you evaluate when deciding what program to go on. Because some of the Advantage plans may stop at 20 days. So that means you're on the hook for the next 80. So.
Okay, thanks.
Yeah, no problem. Great question, Sam.
Anyone else have any questions?
We're giving free advice.
Yeah.
Right, Ann?
While everyone is thinking about that, John, I have a question for you. Can you go through the process of the appeal for IRMA? So
Yep.
let's say in a lot of cases, clients will retire and they may get, a big PTO payout, or they may have deferred comp, for a year or 2 or 5. So what does that process look like, and how likely is it that people will get a reduced premium if their income happens to be higher?
So it's always a 2-year look back. So if you're going on Medicare this year, because it's easiest for me to explain it, they're going to calculate your Part B and Part D costs to the federal government by your 2019 tax return. So if in 2019 your earnings were whatever X, I'm just going to put a big number, $500,000, because you were working, you were getting salaries, you were getting bonuses, all this stuff. Maybe you had some investments, whatever. The point is, you made a lot of money. But this year, because you're stopping work, even in March, your income is $150,000. And I'm just going to assume for this case you're married. They would calculate it initially and say, well, based on $500,000, you owe us $500 here, and the Part D, it might be $600 all told. Your appeal, because there's 2 ways to do it: work stoppage or work reduction. You have to have a legitimate reason. You can't just send it in and say, I don't want to pay it. So in this case, using Ann's situation, I'm going to be work stoppage. I'm truly retiring. That would trigger what's called the SSA 44. And what we do is that form you basically fill out. There's 2 sections that say, yes, here's what I'm going to anticipate making this year. And then even next year, I'm going to anticipate making a lower amount than the $500,000. That goes into the federal government. They would process what you say, and they would render a decision and send back to you saying, based on your information, we will grant you a reduction to X level, reflective of your income. And then for 2021, you would pay that reduced level. Now, if for some reason, when you file your taxes and you actually made $300,000, even though you claimed $150,000, they would catch you and make you pay back the balance of that. So when you make that appeal, it's not asking you to the exact dollar what you estimate to make. But if you working with Ann, she says, here's what your pension pays, here's what you're going to get in dividends. I'm just making these things up. Here's what you're going to get in Social Security. You can estimate within a reasonable amount, where you would end up. But that kind of in the details, but also high level, that's really how the process, it's always a 2-year look back.
But so it makes sense. It's worth the time to go through the appeal process if you have retired and if your income is a lot lower this year than it was, for example, 2 years ago.
If if it's 10,000 less, unless it makes you go from say 88 to 78, then or from 90 to 80, that would make sense. But if it goes from, 400 to 390, there's no point in appealing because you're in that same bracket. And,
right.
Ann and I were talking prior to this about things like if you are going to do Roth conversions, you want to do those obviously 3 years prior to retirement, because if it's 2 years, they're still going to look back at your income. So at 65, if you retire and go on Medicare, they're going to look at your age 63. So doing a Roth conversion, that will not allow you out of this because that's not earned income. That's, that's not work stoppage or work reduction. That's just earned income. So preparation is key when you're going into Medicare.
Awesome.
And then also real quick, and again, HSAs, we love HSAs. Let me just take on an extrapolation here. If you have money in an HSA, you can use it for everything in Medicare except Medicare supplement premiums. So you can pay Part B premium, you could pay Part D premium, you could pay Part C premium, you could pay copays, you could pay the Part B deductibles. You just can't pay a Medigap premium because Medigap, as I said, is not technically part of Medicare. And then one other thing, and it's a strategy. So let's say Ann and I are married. God bless you, Ann. And I'm older, which I am. I turned 65. I'm on her health plan, but I decided to go on Medicare. Ann can still fund an HSA for both of us. And I can spend out of that HSA. I just can't fund that HSA because I'm on Medicare. So that's a question that we get sometimes, and about HSA. Someone's like, well, I'm going to go on Medicare, so I can't fund it. Yeah, you can't, but your spouse can. So again, these are the
spouse can fund up to the family max.
Bingo. Yep, exactly.
Awesome.
Karen
I have
has a question.
If you didn't pay into Medicare, do you get Medicare?
Well, Part B you pay for. So it doesn't matter where you've been but Part A, you could potentially have to pay for, and it's not cheap. I think it's $479 a month if you have no credits. If you have 30 credits or to 40 credits, it's half of that amount, but it's not cheap. And then you need A and B to get a supplement. You need A and B to get it. Like, it's a tough situation.
Okay, thanks.
No, great question.
So you mentioned the most common plan that people are picking is G. Why is that? I know, I mean, I've seen the charts of all the different plans and what they cover, but why, in your opinion, is that the most popular plan that people are choosing?
So historically, Plan F was always the most popular under what's called MACRA. It's a government ruling that came out. They don't want to allow anymore 100% plan. So Plan F covered your Part B deductible, and for conversation's sake, the 20% of Part B. Part G, you as the applicant or insured have to pay the Part B deductible, but after that, the plan covers the 20%. So this year it's $203. So if someone has Plan F and goes, oh, I love my Plan F, great. The only difference between you and them would be that you pay $203 and they don't. But the advantage you have is you pay less premium than they do. And typically that lower premium would more than offset the savings of $203. On average, we see someone going on G today spending at least $300 less than if they went on Plan F. So 300 more than offset, because there are still people that can get F because of a grandfathering of that program. But Plan G is definitely the most common that we see overwhelming percent of our clients enrolling in. That's a good question, though.
Thank you. All right, last. Oh, there we go. Hi, John.
How are you? So
great.
I retired from the federal government about 7 years ago, and then I was a consultant for the 7 years, and now I'm retired. I kept my federal health insurance, and will plan on keeping it for the rest of my life. You know, I tried to figure all this stuff out. You know, Medicare, do I need it? Don't I need it? So to take the safe route, ultra safe route probably, I signed up for Medicare A and B.
Yep.
So I have A and B, and I also have the federal health insurance. Yep. My wife is in a situation right now where she's retired. She signed up for Medicare, and by being my spouse, she's covered by federal insurance also. You know, it's screwy as hell as to who pays a bill when I put a charge in, you know, whether it's United Healthcare or you know, Medicare. Am I wise to keep both of those?
Yeah. So, you know, what I can tell you is that you have extremely comprehensive healthcare benefits that I, as a non-FEHB recipient or employee, can't get. And what I mean by that is that you, in a sense, create that Plan F. You wipe out your Part B deductible. You have it addresses fully the 20% of Medicare. Technically, your bills, I know you're confused to a certain degree, but your bills should go to Medicare first. When you take both
they do.
Yeah, when you have A and B together, they're primary, FEHB is secondary. There are a lot of people in your situation, John, that only take A, and in that case, their health insurance is always primary, and A would be that secondary payer. But you, other than, in a sense, paying for Part B, which those people I just alluded to only want A only, they don't want to pay Part B, you also add to your benefits because Medicare, as you probably heard now, has things like durable medical equipment, wheelchairs, beds, hospital beds, walkers that are covered as a benefit because Medicare is designed for people as we age. Medicare will cover things like home health care. Your health plan with FEHB may not be as comprehensive in the areas of home health care. Skilled nursing and rehab, again, providing that benefit because they know that seniors are unfortunately more likely to have hospitalizations and need rehabilitation. So from a medical perspective, you have extremely comprehensive benefits. and then extremely low to almost negligible out of pocket, other than say your prescription drugs, which just have copays regardless. What I can tell you, sir, is you have excellent benefits. If you can continue to afford them, there's no, I can't, other than TRICARE, I can't offer you anything. You know what I'm saying? There's no information I could tell you that would make you contradict that.
I mean, they are expensive, United Healthcare, because, and then, you know, the Medicare stuff between the two.
Everything's paid for.
You know, my thought was that I could keep the federal insurance and drop the Medicare, because then United Healthcare would be primary. And they've served me well and my wife well for the last 30 years. So.
Well, understand this though, if you drop Medicare, you're going to be under the benefits of just your United Healthcare plan for most of your medical care other than Part A. So deductibles, co-pays, and all that you don't pay today, you'll start paying those. I'm not saying it's a good or bad. I'm just trying to explain to you that there is a cost benefit that you're experiencing today. By paying more, your out of pocket's almost zero. By paying less, by removing the Medicare Part B, you will inherently pay more for your medical care as a consumer, not in premiums, but as a consumer.
Thank you.
No problem. Great question.
All right.
I guess I answered all the questions, Ann.
Yeah, you did a great job, John. Thank you so much
kind.
for thank you for all the information, the presentation. And if you all have any questions that come up, you wake up in the middle of the night in sweats thinking about Medicare, you know where to find me, you know where to find John now. So thank you again for your time, for joining us today. And thanks again, John, for all the great, valuable information that you shared with us. I'm grateful to you for that.
Thanks again, Ann, and thanks for everybody for joining us. I look forward to answering any questions or helping you on your Medicare journey or into retirement planning. Anything we can do to help, we're glad to do that.
All right,
Thank you.
awesome. Thank
John,
you.
Ann.
Take care, everyone.
Thank you.
All right.
Might be a good idea to keep both.
He didn't say,
You didn't
he
say
said
you
as
don't
long
need
as you
it.
can afford it, you know. I mean,
Right, so everything's being paid for, you know?
my-